Body Beautiful. We're at the last stretch here, and we've got a lot of phone calls. I want to try to get to them. Any questions you have about skin protection, the phone number 800-440-4884. Let's just jump right into it. You know, Yvonne's been sitting there for a while. Yvonne from Santa Rosa, good morning. You have a question for Dr. Lee.
Hi, good morning. Yes, I had noticed about 18 months ago that I had a spot on my left hand, and I thought that it may have just been a sunspot. But I've noticed that it seems to be slightly raised, and on the weekend it seemed to have like a little trace of blood going, like a little bit of blood around it.
How old are you?
I'm 49.
You should go to the doctor and have that checked out. Any kind of area that bleeds or is rough should be looked at.
Okay. All right. Well, thank you so much.
You're very welcome.
Yeah, let's get right on that. Well, we had Cookie from Napa who was getting some brown spots on her face.
Brown spots on their face, I mean, again, sun exposure related to hormones. You can use skincare products that can help to bleach them. The most important thing is staying out of the sun. We also have talked about intense pulse light therapy for treating these, the IPL laser. But in order to maintain any benefit that you obtain, you have to stay out of the sun or protect yourself from the sun.
There are products that can roll back the effects, right? The vitamin C serum?
Vitamin C serums help with future damage. The Obagi products that I use in the office help to make the skin healthier and reverse some of these changes. They also use retin A. The Obagi products use retin A, which is a very active component and necessary for skin rejuvenation.
Okay, we're not here to talk about any products in particular, but I happen to have this in my purse, the Tan in the Can product. This is actually not the can, this is a towelette.
No, but Tan in the Wipe. Okay, so those are very nice products if you really liked the way you look when you're a little bit tan. It's important to make sure that the product is a dye and is not actually reacting with your skin, because some of the ones that react with the skin, to my understanding, can be dangerous. It's also most important to recognize that just because you've tanned yourself with one of these Tan in the Can products doesn't mean that you have the protection of the extra pigment in your skin that you would have if you were tan. Not that I'm recommending tanning, but there is the understanding that darker skin has more melanin and is therefore at less risk for sun injury.
And another rule of thumb, if you have light eyes,
if you have light eyes, you need, but I really hesitate to say that as a rule of thumb. Everybody should be careful.
Okay, some true and false really quickly here. We talked about, darker complexion, don't need to use sunscreen.
You absolutely do need to use sunscreen.
Okay, a sunscreen with SPF 30 is always more effective than one with SPF 15. True, false?
False.
Okay.
False. Okay, and I'll answer that for a second, because SPF, this was part of the SPF problem. At SPF 15, you're protecting yourself from 92% of the UV radiation. At SPF 30, you're protecting yourself from 94 to 96%, depending upon which study you've looked at. You have tripled the amount of chemicals that are in the product to give you that added protection, so you're at higher risk for other things like hypersensitivity reactions. So most places, if you look at the science, will recommend SPF 15 to 30 with a UVA protection.
Okay, and again, zinc oxide?
Titanium dioxide, but titanium doesn't get, yes, those are good, but they do not get the full range of UVA spectrum. Only zinc oxide gets the full range of UVA.
When I was a kid, we'd see the lifeguard with the big white nose.
Zinc oxide.
So that was
well, that was zinc oxide, but
now
we have a more cosmetically acceptable zinc oxide formulation.
And once again, to scare folks, even basal cell carcinoma, a friend of mine had a little one, just a little bump, wouldn't go away. Turned out the thing had grown all the way down to her neck.
And that's unusual. I mean, I don't want to scare people from going to the doctor. Most of these things can be taken care of relatively easily with minimal scarring, and it's much better to get them taken care of sooner than later.
Well, and we don't want to scare them to not go to the doctor. The idea is to go to the doctor if you have
sooner.
Any concerns. All right, thank you, doctor. Interesting stuff, important stuff. We hope to see you again. For more information, because we are out of time, about Dr. Lee, call her yourself at 510-704-2170 or check her out on the web at artfulsurgery.com. Thank you so much for joining us.
My pleasure. Thank you for having me.
All right, everybody, have a great day. Take care of your skin.